Hello everyone. Now we are going to discuss about normal hemostasis. Whenever there is a vascular injury, it will result into the leakage of blood. Vascular injury due to any reason will result into the leakage of blood. Normally this blood loss is prevented by thrombus formation. Due to various processes that we will discuss now. Platelets, clotting factors, and endothelium plays central role in formation of blood clot after the vascular injury or at the site of the vascular injury. Now we will see the sequence of events in a hemostasis. Sequence of events in hemostasis. First of all, as we have discussed, there is a vascular injury. Vascular injury results into activation of endothelium. This is the endothelial cells. Endothelium release endothelin, which it causes vasoconstriction. Vasoconstriction to decrease the blood flow of the tissue. So this is the first event in hemostasis, vasoconstriction. After the vasoconstriction, platelets start accumulating at the site of injury, and they adhere at the site of injury, secrete various granules and form a primary clots. Platelets adhesion and aggregation at the site of injury result in primary hemostasis or primary clot formation. So this is the second event in normal hemostasis. After the accumulation of platelets, there are multiple clotting factors or coagulation factor in plasma. They start to incorporate into the primary clot of platelet by various mechanism. Plasma clotting factors start accumulating in the site of injury and form a secondary clot or result into secondary hemostasis. This is also known as permanent clot formation, as this is the blood vessel, this is the site of injury. First platelet accumulate, then clotting factors come and form a permanent clot. To prevent the propagation of this clot or thrombus to the normal sites, or from occluding the blood vessel from increasing size of this thrombus, there is a counter regulatory mechanism known as anti-thrombotic mechanisms, like activation of fibrinolytic system. So they contain the clot at the site of injury and will prevent the propagation of the clot or thrombus elsewhere. So this is the last step of hemostasis. So in hemostasis there is a vascular injury. Vascular injury result into the vasoconstriction by releasing endothelin. After vasoconstriction, platelet accumulate at the site of injury, which result into the primary hemostasis. After the accumulation of platelet, there are accumulation of clotting factors within the primary clot and form a permanent clot, which result into the secondary hemostasis. And to prevent the propagation of thrombus, there are activation of different antithrombotic mechanism. So these are the events in hemostasis. Thank you.